So the outcomes of this session are for you all to be competent and to accurately carry out observations and to record your patient's vital signs, for you to understand what a new score is, to recognise a deteriorating patient, to use the deteriorating patient escalation algorithm and to take action when necessary. It's also important for you to be aware of your own limitations in your knowledge and competence and to undertake further training if necessary. You must also report any concerns to a senior member of your team. So what are your responsibilities? You are, of course, all responsible for your own e-learning module that is accessible on ESR. You must also complete your practical basic life support competency, and this must be completed each year. It's also important to complete a full set of observations. There is no point recording a set of observations if you miss out a temperature, for example, as this will not give you the correct news score and could also miss out vital information regarding a patient's condition. And finally, it is your responsibility to escalate any concerns to a senior member of staff. So what are vital signs? These include all of the following: a pulse rate, a temperature, a blood pressure, respiratory rate, measuring a patient's conscious level, and oxygen saturation levels. You should all be familiar and have access to eVitals, and all data inputted is linked to CareFlow, so the new score is shared. It also prompts you when a patient is due the next set of observations, or will prompt you if the patient's new score is high and escalation is required. So we must complete an initial set of observations on all of our patients. This will provide us with a baseline. We can sometimes respond to this information with medications or simply by changing the position of our patient. Repeated observations may suggest the need for oxygen or even IV fluids. By repeating observations on our patients, we're able to recognise a decline in their initial presentation. If there is a rapid deterioration and a patient becomes acutely unwell, a 222 call should be activated, and we must monitor our patient continuously and document accurately. Each of our patients must have a recorded set of observations irrelevant of their previous news score. For example, if your patient has a news score of 0, you would still repeat their observations 4 hours later. If a patient has been transferred to one ward to another, you must again repeat their observations, even if they were taken only 30 minutes previously. And if a patient has deteriorated before a transfer, they must be reviewed. It may be necessary to continuously monitor the patient during their transfer. So what does routine monitoring include? So we're going to take the respiratory rate of each of our patients, and we expect this to be between 12 and 20 respirators per minute. We're going to measure their oxygen saturations, and these should be 96 or above. This is with or without oxygen. We're also going to measure our patient's pulse rate, and we expect this to be between 51 and 90 beats per minute. Our patient's systolic blood pressure should be between 111 and 219, and their temperature should be between 36.1 and 38. It's also important we measure our patient's conscious level. We would expect all our patients to be alert. However, if they have a new onset of confusion, or if they are only responsive to voice, pain, or unresponsive, then this would be a cause for concern. So let's take a look at the green escalation. This is for anybody that has a news score between 1 and 4. The frequency of observations must be 4 hourly as a minimum standard. The nurse in charge of the clinical area must be informed, and a registered nurse must reassess the patient immediately. A registered nurse must increase the frequency of vital signs monitoring and consider whether escalation is appropriate. This will be based on a patient's baseline vital signs and a level of concern related to a patient's assessment. All actions must be documented, and any deviations away from the trust and use escalation pathway must be documented with clear evidence of the decision-making process. And we have amber escalation. This is for any patient that has a news score between 5 or 6, or if any individual vital sign scores a 3. For patients scoring a news of 5 to 6, the staff must inform the nurse in charge in the first instance. A registered nurse must reassess the patient immediately using a structured ABCDE approach. Observations must be taken and recorded hourly. A fluid balance chart must be commenced, and the patient must be escalated to a middle grade doctor who has a maximum response time of 30 minutes. If no response, escalate to the next most senior clinician. And then we have our red escalation. This is for any patient that scores 7 or above or has a sudden deterioration to their condition. For patients with a score of 7 or more, it is anticipated at any time that the patient's condition will deteriorate quickly, and the following actions must be taken immediately. We must inform the nurse in charge of the ward, and a registered nurse must reassess the patient immediately using a structured ABCDE approach. We must increase the frequency of news monitoring to at least 15-minute intervals. A fluid balance chart must be commenced, and the patient must be escalated to a middle grade doctor who has a maximum response time of 15 minutes. If no response, then escalate to the most senior clinician. Consider escalation to critical care outreach who are available on bleep 654. And care must be provided in an appropriately monitored environment. If we take a look at this completed news chart, it is easy to identify where there are any major changes in the patient's condition. Initially, the patient's respiratory rate fluctuated. We can then see where it remains consistent for some time. We can see the patient started on scale 1 when measuring his oxygen saturations, and then there is the transition to scale 2, and the patient was administered oxygen via nasal specs, which has been titrated from 2 litres down to half a litre to meet his target saturations of between 88% and 92%. The patient's blood pressure has not given any cause for concern. We can see that this patient has persistently been tachycardic. The patient has remained alert throughout and has never spiked a temperature. So the only issue we have with this completed observations chart is the missing data from 2 AM on the 21st of January. If the patient had become unwell at 5 AM when the next set of observations were due, we would be asking the question of why did this set of observations not get taken, and could we have escalated earlier on and potentially avoided the patient becoming further unwell. And lastly, here is a copy of the news and deteriorating patient escalation pathway. If you are ever unsure of the escalation process, this will tell you exactly what to do. It is clear and it is precise. And always remember to seek help immediately if you have any concerns for any of your patients. So let's give an example. Like any piece of documentation, it is essential that we complete the form using the correct patient details. These forms would be completed in the event of e-vitals not working, so it's really important that you familiarise yourself with them. It's important we put the correct date and the correct time. As you can see, each vital sign has been accurately logged using a simple dot. And we're always going to join up our blood pressure so we can identify the systolic and diastolic blood pressure reading. We can see by using the coloured key chart if a patient's score is within normal ranges by just looking at the colours. Red identifies a very strong concern and scores a 3. Orange again is a cause for concern and scores 2. And anything yellow suggests this is abnormal. Any dots in the white squares suggest the patient's vital signs are within normal ranges. So by adding these numbers up, we're able to get a new score. So Mr. Granger is a 67-year-old male who has been admitted with a chest infection. His observations are as follows. So he has a respiratory rate of 26 respirators per minute, an oxygen saturations of 91%, a blood pressure of 140/77, a pulse rate of 119 beats per minute, and his consciousness level is alert. He has a temperature of 39.1. So we put this data into our news chart and his news score was 10. The nurse has escalated and we give Mr. Granger 2 litres of oxygen via nasal specs and he has 1 gram of IV paracetamol. This will hopefully address his low oxygen saturations and his temperature and his pulse rate. So we take another set of observations and Mr. Granger's news go up by 1 to 11. This is purely because we have given him 2 litres of oxygen. We repeat his observations again and we can see actually he's responding really well and his news score is now 6. And then we do another set of observations and he's responded really well and Mr. Granger's news score is now 4. So we can see that the nurse looking after Mr. Granger has responded to the high news score of 10 and escalated. Paracetamol and O2 was given and we can see a decline in the news score which reflects this.